So dear students, today we will discuss a image study which is very interesting, not that common, but often we will see because now gastroscopy is very commonly done. So just see what this interesting image is. See that what is this condition in this image. See that this, you can see the contrast area. This is nothing but barium meal X-ray. You can see that there is a filling defect here in the fundus. This is the fundus of the stomach. There is a filling defect here. So what is this? So this is the barium meal X-ray. So how to do barium meal? Barium sulfate solution. It is barium is radio opaque. In barium and sulfate media is inert. Barium phosphate should not be used. All of you know that. Barium in phosphate media is poison, neurotoxic. Barium phosphate is nothing but rat poison, where barium is toxic to the brain because it gets absorbed. Same issue as rat poison. Somebody eats rat poison, it is hepatotoxic and neurotoxic. The head of liver failure and neurotoxic. Mainly hepatotoxic. So liver failure, imminent liver failure is very common. Many situations in such a patient, liver transplantation is the only answer. Emergency liver transplantation is the only answer because entire liver goes for a complete necrosis. So barium sulfate is used, not barium phosphate. It's an inert. So barium sulfate solution is given to the patient to drink, and around 500 ml. Now currently microcrystallizer barium sulfate solution is good. It's called microbar solution. And once the patient drinks that, usually under fluoroscopic control, it is visualized in different areas and films are taken. And many films are needed to study properly. And fundus, body, antrum, pylorus, then duodenum and jejunum and other areas. Eventually late films will be able to see that. And so that is exactly barium meal study. Sometimes contrast barium meal, air contrast barium meal study also will do. Ask the inflate the pasteurize to inflate the stomach with the air, then you can do air contrast barium study. In the traditional method barium meal, it is not necessary. You can see trifoliate duodenal ulcer, absence of duodenal cap will be there. Trifoliate duodenum can be seen in a complicated chronic duodenal ulcer. Then irregular filling defect in carcinoma of stomach. In stenosis, the dye will not enter the second part of the duodenum. In case of pyloric stenosis with the gastric outlet obstruction, food may be there within that, within the mixture with the barium as a mottled appearance. The dye will not reach this one. Dilated gastric greater curvature of the stomach below the curvature of the iliac crest. There is a radiological finding of the gastric outlet obstruction because of the pyloric stenosis, because of the chronic duodenal ulcer. And irregular filling defect is a feature of carcinoma. So same thing here in this patient, there is a filling defect here, maybe smooth or irregular filling defect, and could be polyp. That's what exactly. So it looks like a polyp. So radius and polypoid lesion is there. It may be malignant polyp also. So can't say it is not malignant polyp. So probably it is gastric polyp. Polypoid carcinoma of the stomach also possibility, remember. So all those things I have already told how to do barium meal study. This entire thing explains very clearly how to do barium meal study. And gastric polyps are commonly hyperplastic, they are benign. And sometimes adenomatosis, they are pre-malignant, potentially malignant, not malignant, potentially malignant condition. And especially when size is more than 2 cm or if it is multiple. And in such a situation, we have to do gastroscopy, take biopsy, confirm whether it is benign or malignant. And polypectomy is done if it is benign. Multiple polyps are difficult to manage. Regular follow-up gastroscopies are done if you are leaving like that. And if you think suspicious multiple polyps are there, then total gastrectomy has to be done. If you think, if after biopsy comes as a carcinoma of stomach, polyp converted into carcinoma of stomach, then you have to do a D2 gastrectomy as a curative therapy with additionally chemotherapy as a adjuvant therapy at a later period. Of course, we need to evaluate by CT abdomen and chest for the metastatic workup. Once you confirm that it is a carcinoma of stomach, like a traditional carcinoma of stomach management you have to do. So polypectomy or surveillance. And multiple polyp, suspicious of multiple polyps, total gastrectomy the treatment. So depending on the individual case by case basis you have to do that. And H. pylori therapy is very, very useful. Many gastric polyps are due to H. pylori infection. So triple therapy, therapy is very useful for the gastric polyp. So trial therapy has to be given in such patients. Follow-up gastroscopy as a surveillance, also very important in such patients. So students, you can always go through my SRB manual of surgery for detail about the gastric polyp, carcinoma stomach, everything is there in the manual of surgery stomach chapter. You can always go through that, and also you subscribe my website, wherein everything is small lectures regard to the case scenario, image study, then instruments, and live sessions are there in this one, weekly once or once in regular intervals, wherein senior faculties are there in the live session and covering clinical examination of different aspects, which is useful for exam or learning surgery as such. They will answer your questions, queries. It's a detailed this one. Somebody will present detailed presentation like in the exam with the answer and questions with the interactions. So you can always put your question, doubts in the chat box and get answer. So wait for different live sessions, whatever live sessions are there in the YouTube. Please go through that after subscribing. That will be very useful to learn surgery, clinical aspects, practical aspect. So everything. Instruments are there in my small lectures. Small case scenario is very important. On-table findings are there. That will give a clear idea about the general surgery concept. As such, if you see daily 6 to 8 minutes lectures, it will be very useful. Please subscribe my lecture and go through that. And so answer the MCQ. Commonest site of gastric polyp is a fundus body antrum pylorus. So put it the right answer in the comment box. I will really acknowledge your answer, and later I will put the right answer. And next MCQ is trifoliate duodenum is a feature seen in duodenal polyp, secondary duodenal diverticulum, primary duodenal diverticulum, many trace disease. Again, put the right answer. I will acknowledge your answer. And quotation of the day is, it requires nil to treat someone with respect. It's very important. It's very easy. Respect somebody. All human beings deserve respect. So don't de-respect someone. Always give some respect to everybody. That's the basic. It should be the basic nature of everybody. I think that is the quotation of the day. Again, I request students, all of you, subscribe my channel for your better learning, case scenario, mainly case study, and operative finding, and basic suturing techniques, skill technique, and few instruments, and live sessions with the senior faculties of different clinical examinations and discussions, especially for exam. It will be very useful. Again, requesting to join my YouTube channel for better learning of the surgery. So students, I hope you have understood. Students, please go through my SRB's manual of surgery, very popular book all over the world, and my clinical methods in surgery with the video lectures supersedes all other clinical book with the proper information. Everything is covered with the videos, instruments, specimens, basic orthopedic, and also operative surgery briefly. So everything for the clinical side, for CBME syllabus or practical point, it is very useful. And my operative surgery, Atlas of Tissue Approximation are very popular books. And please subscribe my website, YouTube, Instagram website for further knowledge and daily regular knowledge. And my DigiNow lectures are there for 220 hours through JP Publishers. For 1 year, you can always purchase and have increase your surgical knowledge, because everything is covered, including your specialties, every general surgery, gastro surgeries, basic operations, instruments, everything as per CBME syllabus for UGs and also for PGs, basic information. It gives everything. DigiNow lecture for 220 coverage is very useful for you. Please, you can purchase through JP Publishers. So please subscribe my, again requesting my YouTube channel, which is free, SRB Surgical Insight. QR code is here. I hope you understood this lecture very well. Thank you so much.